Hello and welcome everyone to the Difference Maker Show. This is Lynn Sanders, your host, and I am really glad you're here today. I have a special guest. His name is Mark Bogen. He's the County Commissioner of Broward County, one of the largest counties in the United States, and also the Mayor of Broward County. He has important information to share with all of us today, so I'm very excited to be able to have him here. Thank you for coming, Mark. How are you doing?
Good, Lynn. Great to be here.
I've heard through the grapevine that you have a medical test that is a new test that's saving lives in Broward County. So can you tell us first how you even heard about this and then what you're doing in Broward County to help people?
Sure. So let me correct it. I don't have any test.
Oh,
Okay.
okay,
What
sorry.
what the hospitals around the country have the technology, and I can talk about what technology is being used and what we're doing.
Great.
Basically, many years ago, I had a visit over to one of the best hospitals in the world, Mayo Clinic in Rochester, Minnesota, and one of the cardiologists, which showed me a, a test that's done with a CT machine. It's called a cardiac CTA. It's a virtual angiogram where they could detect soft plaque and hard plaque. That's what causes 90 something percent of heart attacks, which is the leading cause of death. And so there's an actual a preventative test that can be used that this cardiologist explained to me for certain people and people who are at high risk. For example, people who have high cholesterol, people who have high blood pressure, or people who have a family history, or people who are smokers or diabetes. One of those five, you are especially at a higher risk than others. And so this technology basically can look at your arteries and see if you have hard plaque or soft plaque, which could lead to a heart attack. So once I learned about that, here in Broward County, we're the only county doing this. We put up millions of dollars to give our Broward residents a free test at our local hospitals. Cleveland Clinic in Weston, Florida, is leading the way, and basically we've been giving over 7,000 scans already over the past 2 years, and have helped the lives of over 4,000 people so far. 61% of
Wow.
everyone that's gone through has needed some type of medical help, medication, stents, open heart surgery. And these are all people with no symptoms. They all feel great.
Wow, that's very impressive. Saving over over 4,000 lives, you said?
It's 61% of the people went through it. And so we are using this we are not, we being the county. The county is paying and the hospitals are providing this test. And we've been told we're the only county or cities doing this type of preventive test in the United States. And and it helped my life. I found out through this test that I had a 70% blockage of soft plaque in my widowmaker. I never knew it. I never had any symptoms. I felt great, but it allowed me to catch it early. I had a stent put in, and so we're continuing it now with Cleveland Clinic as the leader of the leading hospital doing this.
Wow. Well, I know most people would probably wonder, how did you even think of going about this? What motivated you to create this program with the hospitals?
Well, as I said earlier, I had a family member that passed away unexpectedly, so I was worried, do I have to worry about it? Do I have a family history now? Will it happen to me? So it got me to go to, I got an introduction to Mayo Clinic in Rochester, Minnesota, and that's where they said, hey, there's a test that you could take that can look to see if you have plaque in your arteries. And the old days, there's something called a calcium score test where hospitals did something with a similar, same machine, but they didn't give a contrast. And so all it tested for was hard plaque. The most dangerous plaque, I've been told, is soft plaque. It's the most unstable. It's the most chance that that can rupture versus hard plaque. So the calcium score fails to talk about soft plaque, show soft plaque, detect soft plaque, where the test we're doing is with contrast, with not we, but the hospital is doing. I keep saying the hospital is doing this for our residents, where it's with contrast with an IV, and and we've been saving thousands of people's lives or assisting them.
Now, people who don't know much about heart tests might wonder, Well, how is this different than a stress test? I know you're not a doctor, but could you give us your opinion or your thoughts about the
All
difference?
I could do is tell you what I've been told. Yes, I'm not a doctor. All I could do is in the olden days before the technology, the stress test was the test. But I've been told, right or wrong, I've been told that the stress test cannot see the soft plaque. I mean, it cannot see the things that a cardiac CTA can show.
Wow.
And so while the stress test may be valuable for certain things, the cardiologists that we're working with and the hospitals are telling us that the cardiac CTA, this virtual angiogram, is the ultimate and the best test to see whether you have cardiovascular disease and plaque in your arteries.
Now, you have some incredible success stories. Could you share a couple of them with us?
Sure, I could share. Um, so there was a Major League Baseball player. He played 17 years for the Dodgers and the Yankees. His name is Steve Sachs, and Steve right now, I believe, is in his early 60s. Steve, after playing baseball, stayed in shape. He did kickboxing, he did martial arts, ate healthy, was trim, and never had any symptoms. Nothing. He felt great and came to Florida. We got him to take the test, and he found out this was in 2025. He found out that he had four arteries that were 95 to 99% blocked. He went back to his home in California, showed him the scans, and they said, you need quadruple bypass immediately. He then came back to our county after the surgery when he was able to and thanked us, saying that test saved his life. And we have video videos of all different people from all walks of life who have talked about how they felt great. They didn't know they had any problem, and that this test helped save their lives. And I should point out to you that 5% of our people taking the test found out they have clear arteries, but people saw that they had beginning stage of lung cancer or AFib. So this test not only can look at your arteries, but can also, um, detect other things as well.
So, people who have any kind of heart concerns, can they just go to their doctor and say, "I'd like to take the cardiac CTA test" if they're not in Broward County? What do you recommend?
People need to, it has to be done with a script. A doctor has to order it. So you could say all day, I want to do it, but unless a doctor orders it, it's not happening. And certainly I would, if I were somebody that either had a family history or has diabetes or has high blood pressure or has high cholesterol or is a smoker or they're up in age, I certainly would get this preventative test. I'm not a doctor. I can't say, tell people, what the right and wrong thing in medicine. All I could talk about is data. And the facts are that we have scanned over 7,000 people at the area hospitals with these cardiologists overseeing it. We have a group of cardiologists overseeing it. And out of over 7,000 people that have been tested, again, these are people that have no symptoms whatsoever. Over 4,000 of them have needed medical attention. And hopefully within the next 12 months, all of this data will be published. We have a group that is looking to put this together to publish this data.
Well, that's very important. I think, isn't heart disease the number one killer for all diseases, or is it number two?
They say every 36 seconds, but I'll just say every 60 seconds, someone dies from heart disease.
Wow.
So, we've been on for several minutes, and, you could say, you know, if we've been on for 5 minutes talking, five people have passed away already from heart disease. It's the leading cause of death. People think cancer is, but if you go out and add up all the cancer deaths, every cancer, the leading cause of death is from heart disease and heart attacks. And 90 something percent of all heart attacks come from something within, I've been told, with the arteries, being blocked, whether it be from heart or soft plaque. So I believe I've been persuaded by doctors who love this test that this is the ultimate test, and we were proving it in Broward County, Florida here every day.
It's so fantastic. People typically get preventative tests, like women get mammograms or colonoscopies. What are your thoughts about having something like this as a preventative? What's your vision for the future?
Well, I wish I was the person that could make the rules on that. I mean, if I had the power and I had the authority, I would just tell people, look at the data. The data speaks for itself. And based on what it's done for me and thousands of people, I certainly would argue in favor of that this being a preventive test. Again, definitely for people over the age of 45 with these one of five factors. People who aren't one of the five factors, I still, at a certain age, whatever doctors would recommend, I certainly would still recommend it. You're looking at your arteries, and it's the leading cause of death. So, and I should point out there are doctors that came to us that didn't agree with what we were doing.
Really?
There were doctors that, cardiologists out there saying, well, wait a second, you're going to get radiation. The patients are getting radiation. But when someone takes a nuclear stress test, they get radiation. When someone goes for a chest X-ray or anything, they get radiation. But there are sometimes some doctors, I don't know if they feel threatened. I don't know what the reason, but there were some doctors that were against what we were doing when we started this 2.5 years ago. But majority of the cardiologists we're working with, they love it. They think it's been great. They think it's been, the data, again, the data speaks for itself. Lynn, I want to make sure I end by saying I'm not a doctor.
Right.
I am not recommending anything to anybody. Um, and people need to consult with their physicians, to take action. All I could talk about here in Broward County, Florida, is what we've been doing, what the results have been, what it shows, and I'm entitled to my belief. My belief is this is an incredible preventative test, and again, people should talk to their cardiologist about getting it.
Yes, it saved your life. It sounds like it saved a lot of lives of people you know. So where can people learn more? What's the website where they can learn more about this test, especially
Well, for Florida residents, though it'll answer a lot of questions from people, we developed a website called takehearttest.com. Takehearttest.com. It answers a lot of the questions. It shows kind of what we're doing. But again, people need to talk to their doctor. And if people get referred to just getting a calcium score, they should say to their doctor, why aren't you wanting me to see if there's soft plaque in my arteries? Some people may be allergic to the contrast, and therefore they can't get our test. They can't get the contrast. So they'll get the calcium score. But assuming they're not allergic, they should be asking their physician, why aren't you recommending I call it the complete test with an IV with contrast versus just the calcium score?
wow, it's so important. So this is information everybody needs to know. We're not doctors, but we're giving out information that everyone would be finding valuable. Are there any last words of advice? You've given so much good information here, Mark, that you'd like.
No, when I go and talk as mayor of Broward County, when I go and talk about it, I make sure I let people know that, this is not lay people putting this together. We are working with cardiologists from different hospitals. We have a committee of cardiologists that have come up with a criteria of the best type of people that would be for this type of preventative test. And and again, the data shows over 7,000 people who have been scanned, over 4,000 people needed medical attention. And what more can you say? There's no that to me is the best answer. If we scanned over 7,000 people and 100 people needed help, it would be kind of like, well, the data shows this should not even be looked at anymore.
Right.
But
The data is
but
proving that this
and
is a
yeah,
value.
and the Florida in our hockey team here, the Florida Panthers, they are now getting involved in helping sponsor this, and other companies may be joining soon to help fund the preventive test to continue once money starts running out.
That's fantastic. So
Yeah.
everyone go to takehearttest.com, and I imagine your contact information is there, or do they just contact whoever's on the website? Is that it? Just
Yeah, if somebody wants to contact us, it's Broward County, and they can give a call and they'll reach us.
Great. Thank you so much. This has been a very meaningful conversation, and I know it's going to touch many lives and make a difference. And that's what we're about. And that's what you're about. Thank you for your time.
Thank you, Lynn. Take care.
Thank you too.
Bye-bye.
Bye-bye.